Hello, and welcome to the Chamber Foundation's Path Forward series. For the past 2 months, our nation has been battling a surge in COVID-19 cases amid the rise of the highly transmissible Omicron variant. To give you an idea of just how quickly this new strain has spread, just last month, estimates showed that 90 to 95% of U.S. COVID-19 cases were from the Delta variant. Today, the CDC estimates that more than 99% of cases in the U.S. are from Omicron. And while there are encouraging signs that symptoms from this new variant are less severe than previous versions of the virus, hospitalizations and deaths continue to rise and have had a devastating impact on our healthcare system. You can see in this new graph from the CDC just how significant the impact of Omicron has been on hospitals and healthcare workers based on this spike in cases and emergency room visits during just this surge, far greater than at any other point throughout the pandemic. The WHO estimates that more than 100,000 healthcare workers have died since the beginning of the pandemic, and the mental and physical strain on our frontline workers continues to mount. Today, we'll hear from a panel of experts about the current state of the pandemic, how hospitals and healthcare workers are managing this recent surge, and what this resurgence of the virus means for our economic recovery. Joining us today is Dr. Nancy Messonnier. She is the Executive Director of Pandemic Prevention and Health Systems at the Skoll Foundation and former Director of the National Center for Immunization and Respiratory Diseases at the CDC. We're also delighted to welcome Dr. Craig Spencer, Director of Global Health in Emergency Medicine at the New York Presbyterian Hospital. Joining us to discuss the toll on healthcare workers is Jennifer Schmitz, President of the Emergency Nurses Association. And to supply an economic perspective amid this recent surge, we're pleased to welcome Mark Zandi, Chief Economist at Moody's Analytics. We have a packed program today, so let me try to get right into it. Let me start with Dr. Messonnier. I want to look at these comments that the WHO representative in Europe made over the weekend about the future of COVID-19. And while I'm almost afraid to ask this, given how many twists and turns there have been since March of 2020, is the United States moving into the final chapter of COVID-19?
Thank you for that question. After 2 years, I'm really cautious about anyone who thinks they can accurately predict the trajectory of this pandemic. Frankly, the predictions that have been made by many scientists over the past 2 years have been incorrect. So I do expect this wave to wane, as all previous waves have. And I hope that we will have a period of quiescence so that we can regroup and restock. But I think it's a mistake to believe that this will all be over one day. Omicron, Delta, and the other variants prove to us that there's a reality we need to be able to address, that Omicron isn't done with us, which means we can't be done with Omicron.
So today we're going to talk a lot about the impact of this variant in the United States. But obviously the global perspective, the global approach to the fighting this whole COVID-19 disease is so important as we think about ourselves as global citizens and fighting a disease, a virus that has no boundaries. You have, just since the earliest days of this, been thinking about it from a global perspective. And let me ask you how you think things are going in other parts of the world.
Yeah, this is really an important topic since we all are so globally connected. In most industrialized countries, vaccine coverage rates are going up, and people have access to the other precautionary measures that they need. They have access to diagnostics. Generally, they have access to masks, and they have access to medications. But that's just not true in many low and middle income countries. Frankly, we're leaving low income countries behind. In those countries, not only have they had really delayed access to vaccines and diagnostics and therapeutics, but they also don't have the infrastructure that is needed to deliver those things. And what that means is that also is directly a risk to the United States. That's from a disease perspective, but also from an economic perspective, and frankly, also from a humanitarian perspective.
We'll talk more about that later too. Going back to the United States for a minute, while we're seeing some surges in parts of the country, it does look like the overall case rate could be coming down. Do you expect that decline to continue here?
Yeah, I certainly do. Waves end, and we're already seeing this one start to peak and go down in some areas of the country. But remember that a wave is not felt equally in every part of the country, or even in every state or in every county. And even with the national declines, rates of COVID are still high in many areas of the country. And as I'm sure we're going to talk about, in many areas, hospitals and healthcare workers are still exceedingly strained.
Yes, we are going to get into that and the difficulty that particularly those healthcare workers are facing. But sticking with this for a minute and maybe thinking about a positive development, it does seem that with relatively great speed, we've learned how to prevent deaths, right? That the fatality rate is down. Do you expect that, which this chart has just come up, do you expect that decline to stay static as well?
I'm glad you pointed out that we do need to measure our successes as well. And I think you're right. In the early days, I think clinicians weren't familiar with this virus, and they've learned a lot really quickly about how to better treat it. We also have new medications that are available that are helping. But in fact, recently today or yesterday, FDA actually said that 2 of those medications, monoclonal antibodies, are not effective against Omicron, which is a setback. I also think that the data that you're looking at is impacted by the fact that generally Omicron is less severe than the other some of the other variants, and it's especially less severe in people who are previously vaccinated. What we don't know in the future is if we're going to be faced with another more virulent variant, and that's what we need to always be prepared for.
I feel so lucky to have access to people with such great expertise because I think, at every dinner table and every conference room in the country, people are starting to ask, what's the difference between a pandemic? When does this become endemic? And what will that mean? So maybe you could help us understand what it would mean for COVID-19 to become endemic and if you think that's where we are.
Yeah, thank you. I have noticed also that that you're finding everywhere people having really in-depth technical conversations about these quite complicated issues. So this word is being tossed around a lot. Endemic is used to describe a disease that continues to occur at an expected rate in a region or population. But an endemic disease can still cause peaks. It just causes predictable peaks. So it's important for folks to realize that an endemic disease can still cause a lot of disease. And problem on top of that is, again, that the virus continues to change and mutate. So one of those changes could still produce a virus that escapes our vaccines or escapes the natural infection, the natural immunity that we're building through infection. And that would throw us right back into another wave of disease, just like we're seeing now.
It's something none of us want to think about, right? That we could go back into a place of shutdowns and disruption. And it makes me want to ask you, both how you think we've done in handling this virus and if you think we can get better at it. And what I mean by that is there's been a lot of talk too about can we begin to isolate certain segments of the population that need more protection and not use perhaps as wieldy of a hammer if we get to a place where we need additional protection.
Yeah, I did lose you for a moment, but I think you were asking about sort of how I would say we're doing. And what I would say is, of course, we're always going to be able to look back and think about what we should have done differently or what we wish we had done better. I do think we need to remember that vaccines are still the most effective strategy, but despite the data and the risk, there are people who just aren't going to want to be vaccinated. And we need to think about all the other layers of protection, distancing, masking, and testing, and how we can use all of those tools to get back to the business of living. And I really do believe that we've learned enough over these 2 years to be able to take that information and not go back to where we were in those early months when there was so much fear and we really didn't know what to do and we did everything all at once. I think we can use what we've learned and go back to living as long as we take precautions in our personal lives, as long as we learn to accept the fact that there are some things that are still going to be a risk, but it's a manageable risk. And frankly, as long as we're still prepared to be able to switch back up our protections if we need to. Remember that this is not a light switch that you turn on and off. It's a dimmer switch. And if another strain occurred that was more serious or that was escaping protection, we should be rapidly able to pivot back to increasing our personal level of using those layers of protection.
So speaking of learning, what do you think we've learned, or do you think we've learned lessons that will protect us or help us when the next global threat emerges?
I certainly do believe that we're learning lessons and that we need to be able to remember those lessons. There is a way in which we have this very much a boom and bust cycle. We've had other emergencies before, and when it passes out of our consciousness, we all frankly want to get back to our day-to-day lives, and there are many things that occupy our attention besides pandemics and real issues that folks have in their day-to-day lives. How to make sure that they're getting a living wage, how to put food on the table, how to make sure that they're taking care of their families and their friends and their communities. I hope that one of the things that we've learned is that while we want to rush to get back to normal, we need to learn how important preparedness is. We need to invest in public health, and we also need to invest in our healthcare infrastructure, including preparing and equipping healthcare and public health workforces for the next emergency. I think we need to think creatively and objectively how to leverage our advances in science and biotechnology. The pandemic has also really shown us the deep divides within our country, and I do believe that we need to work together to rebuild trust in our institutions. We need to learn and teach people how to curate the cacophony of information that pervades our society. And we also really need to reinvest in our communities. I hope that this pandemic will help us to better understand the interconnectedness, not only of our country, but the entire world, and the importance and the deep need for basic science literacy among our populations.
I really appreciate that thoughtful answer. I have more questions for you, and I'm sure our audience will, but that question is kind of a perfect pivot to bring in Dr. Spencer, who I mentioned in the introduction is Director of Global Health and Emergency Medicine at New York Presbyterian Columbia University Medical Center. Dr. Spencer, first let me say you've been on the front line since the beginning of this pandemic, and to you and to all of your colleagues, our nation owes a great debt. So first of all, thank you, Dr. Spencer, for that. And second, I wonder if you would walk us through kind of the day in the life of an ER doctor right now.
I'd love to, and thank you for having me here, Suzanne, to talk about this because, we're at this really interesting and confusing point for a lot of folks who see, obviously, headlines saying that Omicron is milder, but at the same time, that CDC data that shows we have record number of people that are coming into the emergency rooms. We have one of the highest levels of hospitalizations for COVID ever over the past couple of years. And it's quite hard for people to figure out what this means for them, for their communities, and for the pandemic overall. So I also want to thank you for extending your gratitude to healthcare workers. It's something that I recommend everyone do for healthcare workers in their life. It is a difficult time for us right now because so many have been infected on the job. So many have been doing this for the past couple of years, and it is mentally and physically exhausting. Even if this is what we signed up for, it's still challenging. So thank you. In terms of what an average day looks like for an ER doctor or nurse or any other provider that's working on the front lines, as Dr. Messonnier already pointed out, it's different depending on where you're at in this country, whether you're in the middle of a surge at the beginning or at the end. If I were to have this discussion with you 2 weeks ago here in New York City, it would have been that just about every patient I took care of had COVID. Some of them had kind of classic COVID. They were disproportionately among the unvaccinated. They needed oxygen. Some of them needed high flow oxygen. They all got admitted to the hospital. But there were also a lot of other folks that had COVID that had exacerbated underlying and chronic health conditions. So people that had a little, kidney problems in the past that got COVID, got dehydrated, and that made it much worse, bringing them into the hospital. Someone who had COVID, got very weak, had fallen down and broke their hip. As we stand today, I worked overnight last night, and I still had COVID cases, but the overwhelming majority of the patients that I were seeing were kind of other things that were coming in the aftermath of this big COVID surge that we've seen here, and on the tail end of the cases coming down in New York City, which is both very rewarding, but it leaves, again, a healthcare workforce that has just been through another, couple weeks or a month or two of really tough conditions for all of us.
You kind of answered a question I wanted to ask you, which is, there's been a lot of conversation. There was a column in the Washington Post yesterday about people avoiding going to the emergency room with severe illness, and because they're afraid of overcrowding, they're afraid of COVID. And so I wanted to ask your advice about that. And if you were speaking to a large population, what advice you would give people who need to go to the ER?
If you need to go to the emergency room, you absolutely should go to the emergency room. Sure, there are a lot of places where the number of visits are incredibly high, where bed supply is short, where nursing or other healthcare staff, may be out themselves, or where, that healthcare supply of workers is unfortunately short. But if you have to go to the emergency room, you have to go. Now, what we're seeing now, different compared to really March and April of 2020, is that here in New York City, in March and April of 2020, just about every single patient that I saw was COVID, and the overwhelming majority of them were pretty severe COVID. Now we're still seeing those COVID cases and some severe COVID cases, but they're mixed in with everything else, with appendicitis, with broken ankles, with all the other things that we see in the ER. If you need to go, absolutely go. The one thing that I have been, concerned about and really doing my best as a provider to prevent is that spread of COVID within the emergency department for people like those who may be immunocompromised, may have cancer, may be on chemotherapy, have done everything they can, gotten vaccinated, avoided this virus for the past 2 years, but are there in the ED and may be exposed. It's important to wear your mask, do everything else that you can to protect yourself. But again, if you need emergency care, please do go. We are taking every measure that we can to keep everybody safe.
I appreciate that frank advice, and maybe I'll ask you to give more frank advice, which is that, one of the conversations that happens as you see these breakthrough infections in vaccinated people is it can lessen the impact of our efforts to get more people vaccinated, right? When they say, well, look, you're having breakthrough infections anyway. And so what do you say to those people?
What I have said and what I continue to say is that the vaccines are doing exactly what we wanted them to. It was 6 months ago or so that I wrote an article in The Atlantic that I think was titled Deep Breath. The vaccines are still amazing, because we've known all throughout that the number one thing that I wanted them to do was to keep people from ever seeing me. From coming into the hospital, getting intubated, needing oxygen, needing to be hospitalized, or dying from COVID. From day one, we've had great evidence that they do that, and they do that very well. They continue, despite the variant that has been thrown at us, they continue to do that incredibly well. If you look at data from New York City's Department of Health, from the CDC, or any other public health department around the country, you see that the overwhelming proportion of folks who are coming to the hospital, that are being admitted, that have severe COVID, that are dying from COVID, are the unvaccinated. If you are fully vaccinated, and especially now if you're older, have underlying medical conditions, and have a booster, your likelihood of getting very sick, of seeing me in the ER, of getting hospitalized or dying from COVID is incredibly low. This is a miraculous breakthrough in what we've been able to do over the past 2 years. Yes, some of the messaging around what the vaccines can and can't do over the past year could have been improved. I think we, undersold and oversold them just before Delta came, and then kind of turned the hot mask summer into the hot vax summer into hot mask summer. So, we had to revise our guidance. And really over the past couple of months, I think everyone has seen people get breakthrough infections amongst the vaccinated. But again, remember that even with the decreased efficacy of the vaccines, even against symptomatic infection, they still do help prevent infections in some people. So being vaccinated not only helps you stay out of the hospital, not only helps you, stop from seeing me or dying from COVID, but it does still provide some protection against getting infected with COVID in the first place.
Thank you for that. Speaking of things you've written, I also noticed something you said on Twitter, which was this pandemic will scar a generation of healthcare workers. Talk to us more about what you see as the long-term consequences.
I think the most obvious long-term consequence is that we've had a lot of people just give up and quit. We've seen a healthcare workforce where estimates are between 10, 15, maybe 20% of healthcare workers have left the profession and may never come back. We've seen nurses who have been exhausted by very high patient ratios before the pandemic, who have found the last 2 years completely unsustainable. We've seen medical residents who have had really their whole training defined by a response to this pandemic. We have systems in which I'm quite afraid, we will blame a lot of the underlying deficiencies that existed before COVID on COVID and not make those long-term sustainable improvements on improving the nursing ratios, having an adequate healthcare workforce to take care of the patients in the best possible way, making sure we talk about equity and access to care, ensuring that we have primary care providers for folks to go to, not only if they need their hypertension or their diabetes treatment, but to talk about things like vaccines, which have been so politicized over the past couple of years. We hopefully will get to the other side of this pandemic, and hopefully soon, but there's still going to be a lot of long-term repercussions. I think the mental health of healthcare providers is something that we should not at all gloss over, because it's something that will continue with us for quite some time.
Are there things individuals could be doing to help healthcare workers right now?
Sure. Obviously, the best thing is, one, get vaccinated. So if you do get COVID, the likelihood you'll be hospitalized or have to see me is incredibly low. Obviously, if you are vaccinated and if you have your booster and you are doing things that are fulfilling, getting back to some sense of normalcy, you recognize that for you, that individual risk is incredibly low, and it is important to return to the things that you love, but all the while thinking about the fact that we respond to pandemics as collectives, and we all need to do our part to make sure we slow that spread in our communities. It means in our schools, it means in our hospitals, it means in the overwhelming and larger community, because every single case helps prevent more cases from developing, from spreading, which helps prevent more folks from coming into the emergency room and needing that acute care. At the same time, we have kind of record high visits for everything else. So personal responsibility is still important in a pandemic that we're responding to as a collective.
Well, again, I have more questions for you too, and I'm sure the audience will, but let me bring in our next panelist, Jennifer Schmitz, who's the president of the Emergency Nurses Association. Jennifer, you just heard Dr. Spencer talk about being an ER doctor in New York and what it's like on the front lines. Is that matching your experience in Maine?
It is in many ways. And I think it's been said twice and very nicely stated that it does vary depending on where you are in the country, particularly around the timing. And so for Maine, we're coming down a little bit, but we did have another surge and a peak. And I think each time we're learning more about the virus and the impact. This particular time was a little milder, but our hospitalizations were still really high. And so coming off from that is a relief for our healthcare workers, but also very similar to other parts.
So what are the top concerns you're hearing from nurses and other emergency responders?
Yeah, it's interesting to listen to Dr. Spencer. I think we're obviously in similar environments, but for emergency nurses in particular, the burnout and the fatigue and the stress of the ongoing work that they're doing really is impacting their work environment, their interest in staying in this role. And he touched on that a little bit as well. But they're tired, and this is a really hard, long path that they've had to endure.
At the chamber, we talk to our state and local chamber partners across the country every day. And one of the things we're hearing is a concern on the ground in local hospitals and communities across the country that they can't find traveling nurses. Can you help the audience understand the importance of traveling nurses and what's going on with that gap?
Yeah, it's an interesting shift in how we've used travelers or the approach to it. But really, they're an asset to organizations to help make sure we do have the staff to care for patients. I think there's more travelers now than we've seen, in part because of what's happening to our workforce. That burnout and that fatigue does lend itself well for them to choose other areas of nursing. And there's lots of options in nursing outside of some of these acute care settings. And so that is making it's more difficult maybe to recruit and to keep people in this for the long haul. And so the travelers are a bridge. It certainly isn't the answer. And I think it doesn't negate us from needing to focus on the work environment and the people that are still in this profession and taking care of them.
Well, speaking of taking care of them, I asked Dr. Spencer a second ago, are there things individuals could be doing or businesses could be doing to support these frontline workers? I mean, we see efforts to deliver meals or efforts to deliver coffee. Those are small touches. Do you think that they're helpful, and are there more impactful things that businesses and individuals could be doing?
Yeah, the small touches are always appreciated. So those are still nice. But I think overall, the healthcare um, industry, really nursing in particular, would support vaccination, social distancing, masking, all of the actions we know reduce the transmission and the spread so that we can get to a more manageable place with this and try to make our work environments just a little bit better and make sure we're providing the best patient care possible. And so those are important. I think the other piece for ENA this year, our focus is on recharge and what that means to the healthcare individual, because as great as they are at taking care of people, it is just as important for them to take care of themselves. And so finding ways and supporting ways in which they can do that to reignite that passion for the work that they do.
So again, that's similar to what I said to Dr. Spencer. We're all just so grateful for the frontline workers and everything that you're doing. And I want to ask you a question. I want to try to help tell your story a little bit. And what I mean by that is, I think it's hard for average people to hear that this variant isn't as deadly or isn't causing as many hospitalizations, and then understand what a hospital or an emergency room really looks like right now. And so maybe you could just explain to the audience a little bit what overcrowding or what it feels like to choose a profession to help people and not be able to help them.
Yeah, it's frustrating. And I think if you walked through today at any emergency department in this country, you would see people waiting to be admitted in a care environment that's not intended for that level of care. You would see patients in waiting rooms, waiting to be seen and not knowing yet what's going on with them. And so that's not only anxiety provoking for the patient, but that's not the kind of care we want to deliver. We want to get them seen and seen quickly. And so emergency departments are full. That wait time is key. And earlier you referenced when to seek care in an emergency department. Always, if you need care, we want you to go there. But there are things that can be done elsewhere. And we talk about testing, routine testing, things like that. And so using that for what it's intended for. But certainly any emergency type situations, we want to be able to provide that care. Emergency departments look different than they ever have.
You talked about recharge, which is so important, and you talked about burnout and exhaustion. And I'm curious how you see this playing out for years to come, even when we do get to the other side of COVID-19.
The recharge, I think, is a good message for nurses. It does not come naturally for most to take care of themselves first. And so staying in this profession, and particularly in some of the more stressful or busier roles, is going to be important in terms of their longevity in their career. And so finding ways to do that, particularly so for ENA, might be education. It might be focused on professional development, more furthering their certification. There are different options for people to re-engage with their profession, to stay in this for the long haul, and And I think that's what we're really trying to focus on, is why did you become a nurse? Why do you love what you do? And how can we support you continuing in this profession?
Well, those are thoughtful things. They're lucky. They're lucky to have you. You know, it reminds me, as you think about mental health for healthcare workers, that the mental health issues broadly in the population have really been a problem throughout the pandemic. On an earlier episode, we were talking about, in particular, adolescent anxiety and depression. And as I understand it, you're seeing a lot more of those issues show up in the emergency room as well. Is that right?
That's correct. And, I think it's a mixture of the pandemic, services being limited on an outpatient basis, ultimately due to the pandemic. And so when services are limited, there's less options for people to seek the care that they need. And that's really where emergency departments are available for them, but we've got to figure out a way to manage that. But the past 2 years have been difficult for healthcare workers, for the world in entirety. And so it is creating new challenges for people as individuals, and then trying to keep up with that on the healthcare side.
And when I asked you what we could do for emergency nurses, first responders, healthcare workers, your answer was get vaccinated. Is that right?
Yes. The vaccination, we know, makes a difference. Nurses recently were named the most trusted profession by Gallup for the past 20 years. And so our ask is trust the science, get vaccinated, do the things that we know reduce the spread and transmission, so that we can move forward through this to see some, I won't say end, I'm done saying end. I think till we get through this particular piece and find a better way to manage this.
Well, that couldn't be more clear. I'm looking forward to sharing that video far and wide, and we'll bring you back in for more questions later. But first, let me bring in our last panelist, Mark Zandi, the chief economist for Moody's Analytics. So we've been talking about hospitals, healthcare workers, surges, but turning to the economic impact of this latest variant, what does Omicron mean for our economic recovery?
It hurts. It's doing damage to the economy. For example, you could see it in retail sales for December. The Christmas buying season was really good coming into early part of December, and then Omicron came on the scene and sales weakened quite considerably as we came into Christmas. It was still a good Christmas buying season, one of the best in history, but it just tailed off at the end, and the Omicron's fingerprints were all over it. You can see it in the job market. Initial claims for unemployment insurance. These are folks that are losing their jobs. They go down to the unemployment office and say, "Hey, I need help." The number of people that are doing that has risen quite considerably in recent weeks, and after falling quite sharply all throughout last year to very low levels, it has now jumped right back up. So. It does look like, we might see some job declines in the month of January. And it goes right back to Omicron's impact on the number of sick people taking care of sick people fearful going to work because of getting sick. In fact, the Census Bureau runs this wonderful survey that they've been doing every 2 to 3 weeks since the pandemic began. Ask a lot of questions, and they one set of questions is to people who aren't working, and they ask, why aren't you working? And in the week ending in mid-January, January 10th, nearly 12 million people said they weren't working because they were sick, taking care of a sick person, or fearful of getting sick. That's a lot of people, and that's create all kinds of labor shortages and problems for the economy. I think now that Omicron is kind of passing through, I think we'll get away with outright declines in economic activity, but it's doing damage, and the longer the wave continues on, the more damage it will do.
So from your seat, what do you think the best and worst case scenarios are in terms of the economy right now?
Well, I think the most likely scenario, and I view it as a very positive scenario, is that the pandemic will recede. And what I mean by that is that in all likelihood we'll get future waves of the virus. There's something coming after Omicron, but the damage that wave does will be less serious than the preceding wave. So Omicron doing damage, but not nearly as badly as Delta did, certainly when you think about it in the global context. And Delta didn't do as much damage as the wave that hit us, hard to remember, but a year ago, we had a very serious wave that did a lot of economic damage to the economy. So I think the most likely scenario is that the pandemic, it's not going to go away, but recedes, and we're able to navigate through better each time we're hit by a wave. Now, obviously, as some of the former speakers pointed out, anyone who's tried to forecast the pandemic has gotten this wrong. So who knows? I mean, this thing could go down, a very different, darker path. And it will, the downside scenario is that the economy really struggles. We lose jobs, and it just takes us a longer time to get back to anything we feel we're comfortable with or normal. We feel is normal. So, but I think the most likely scenario, and hopefully the one that comes to pass, is this pandemic recedes.
And obviously, we live in an interconnected world, an interconnected economy. So as you look globally at the impact of this virus and fighting this surge globally, what does that make you think about the economic risks? I mean, we've got the supply chain reaction and others. And so talk to us from a global perspective.
Yeah, and it is global, and that is one of the problems we've been having. I mean, if you go back, particularly to Delta really hit us hard, but it creamed many other parts of the world, particularly Asia, and more specifically Southeast Asia. And that's where a lot of supply chains begin. I mean, kind of the poster child for this is the vehicle industry. Take the F-150. That's the most popular vehicle produced in the United States. It relies very heavily on semiconductors, chips that are produced in Malaysia. Malaysia got nailed back last summer and fall. It was very lightly vaccinated at that point. And the Malaysian government shut down those chip plants. So no chips meant no F-150s. Inventories collapsed. So now if you go to an auto dealer lot, you can't see any cars. And of course, prices have gone skyward. And so we can't produce the cars. That costs jobs, higher inflation that cuts in people's real income. So, and that goes directly back to what's happening to the rest of the world. Also, the other obvious link is through immigration. The U.S. relies very heavily on immigrants coming into the country. The pandemic really made that very difficult. So, historically, in the last couple decades, we get about 1 million immigrants coming to the country every year, both legal and illegal. Last year, by our estimates, it was closer to 250,000. So that contributes to the labor supply issues. A lot of those immigrants work in construction and transportation and distribution, in the agriculture and tourist industries, leisure and hospitality, retailing. And of course, we know how difficult it's been for U.S. employers to find workers, and that's for lots of reasons, because people are sick, but also because we just don't have the immigrants coming into the country, and that makes a lot of sense in the context of the pandemic. So, what's going on overseas really kind of matters to what's going on here. And if I'm my forecast of the pandemic receding, it comes to pass, it's critical that the rest of the world kind of catches up with the developed world in terms of vaccinations, because if they don't, then it's likely we will see other variants, and the next variant could be more virulent and do more damage than I'm anticipating.
Did this most recent variant change your economic forecast?
It did. So if you go back to, let's say, Thanksgiving, I expected first quarter GDP growth. So a growth in the first 3 months of this year, 2022, and GDP is the value of all things that we produce. I expected that to grow about 5.5% at an annualized rate, which is a very strong rate of growth. Now I expect it to come in, if we're lucky, 2% growth, which is still growth, but uncomfortably slow, and obviously a lot of risk around that. There's a possibility that we could actually see a GDP decline. Now, again, I think Omicron is going to pass through, and the economy is going to come back to life and revive, just like it did with Delta. So the second quarter growth should be stronger as a result. We'll get a lot of that growth back. But it did change my forecast, and my forecast is still very dependent on the path of the pandemic and the waves of the pandemic. The economy is still very closely tethered to the pandemic.
As you can imagine, at the U.S. Chamber, we spend a lot of time thinking about economic growth, a positive economic environment, and frankly, what that does to promote good health outcomes, et cetera, in communities across the country. So as you think about what we have to do as a country to keep a positive economic trajectory, what's top of mind?
Well, we got to get this pandemic under control, and it seems like the most obvious thing is, get people vaccinated and follow good health safety rules. Masking up, trying to avoid large crowds, and doing what CDC and other health agencies are telling us to do. I think that's the most obvious thing. I mean, I think it is a positive step that the administration is now providing more testing kits and better information, better messaging around what should be done. That should be helpful as well. But at the end of the day, I don't think any of us are going to feel good about our financial situation, the economy's performance, until we're on the other side of this pandemic. So that's got to be job number one.
I really appreciate that. And as I said, we're firm believers here that the health of a community, the health of the job market, the health of the economy are just so intertwined. And that's never been more so or more proven during this pandemic. So appreciate your thoughts there. I'm going to bring the rest of the panelists back in so that we can all join for some audience Q&A. I might even put my glasses on so I can actually read the audience Q&A. And I think we're going to start here with Jennifer. Let's start with you, if we might. The question is, how much of hospitals being at capacity is due to the worker shortage that we were just talking about?
That's a great question. It actually can vary depending on the type of unit or even the location and access. It's both, I think. There are days, and I can speak for my own hospital in particular, there are days when staffing is the barrier to open beds, and then there are days when beds is the actual barrier. In the end, most hospitals are seeing more volume than they ever did. And so they're also trying to catch up and match the staffing to that. And so it is a challenge. But more often than not, at least for my geographical region, it is bed availability. And in the end, when it comes down, a staffed bed is important, right? So you can have beds, but you need people to be able to take care of them. And that's actually where the volume and the high census, there's two pieces that you need to be able to manage that. One is the space and the second is the staff. So it's really a both answer.
Thank you for that. Dr. Messonnier, we have an audience question for you too, which is, we talk about this being a global pandemic and it won't be over anywhere until it's over everywhere. What else do you think the United States could be doing to help end COVID-19 globally?
Yeah, I think this is something that is, in fact, the other speakers spoke of too, how connected we are as a world, both from a health status, but as an economic status as well. What could the U.S. be doing? I think the U.S. has in the past really played a leadership role, not only in providing funding, but in working through strategies and working with other countries to help implement those strategies. So I'm really hoping that we will see the U.S. step up to that role. And I think it can really be a crucial point in getting the whole global community together, pulling towards this. I also think the U.S. can really set the bar for this being not only about getting high vaccination coverage today to stop the current wave, but really thinking through the long-term strategy to prevent and respond to the next wave of COVID or the next pandemic after that. And that involves things like improving capacity for surveillance and response, improving lab capacity to be able to identify the next bad pathogen, helping work on health care infrastructure so that community health workers in low-income countries have the salaries that they need to be there when patients get sick. And there's a whole myriad of other issues in terms of, for example, vaccine availability, increasing the capacity of lower income countries to be able to produce their own vaccines and their own countermeasures. So I think it's a complicated equation. The US can play a leadership role and the strategic role. These are issues which our leaders have thought about before with previous pandemics. And now is the moment when we can really make a huge difference.
Thank you. Dr. Spencer, here's a question for you. Can you explain why monoclonal antibody treatments aren't being used right now?
This is such an incredible point with what we've heard over the past few days, with, quite frankly, the disinformation that has been shared by some politicians and others who perhaps shouldn't be messaging on this in the way that they are. Look, monoclonal antibodies are being used. I just received a notification that we're expanding the eligibility at the hospital that I work at because we have an increased supply of the sotrovimab, the monoclonal antibody that we know does work against the Omicron variant. There are a lot of other doses of the Eli Lilly and the Regeneron monoclonal antibodies that we have been using for quite some time that are not being used because they are not effective against Omicron. And we know based on not only lab data, but also the pharmaceutical companies themselves agreeing with the FDA and saying that they should not be used to treat infections which are suspected from the Omicron variant, which, as has already been pointed out, make up over 99% of all infections now. So yes, it is a shame and it's unfortunate that we lost a part of our toolkit. The monoclonal antibodies were helpful for people unvaccinated or vaccinated, the high risk, to help prevent keeping them out of the hospital and prevent them from having severe disease. It does hurt as well that we have a limited supply of the monoclonal antibody that we know does work against Omicron that is being increased. We're seeing supplies augmented around the country, but there's just not enough for the need right now with so many people infected. At the same time, we have other options. So losing those two monoclonals is a hit, but we have things like Paxlovid, the Pfizer oral antiviral, which has the remarkable ability of reducing the likelihood of hospitalization in people who take the oral medication early, up to 90% reduction in hospitalization. We have other medications, a similar oral antiviral from Merck, and other options, including outpatient administration of remdesivir, which appears to as well decrease the likelihood of hospitalization. So losing the two monoclonals is unfortunate, but we have other options, and it should be stated that the FDA's decision yesterday to stop the use of those monoclonals was based on evidence as well as pharmaceutical statements saying that those medications, those therapeutics are not helpful during the Omicron surge.
Thank you for that. I'm not sure which of you to ask this question, but I'm curious, and the audience is curious, about a COVID-19 reinfection. Is it less of a risk when you get it the second time?
As the practicing doctor, I think that question goes to you.
I don't know, you're Dr. Messonnier. Yeah, you've been doing this for decades. Look, what I can say is that what we know, based on CDC data, and really what we've learned over the past couple of years, is that having an infection decreases the likelihood of the next infection being severe or requiring hospitalization. Similarly, being vaccinated does the same. We know that this hybrid immunity as well. So being vaccinated and then having a breakthrough infection or having been infected and then being vaccinated, that further decreases the likelihood of severe illness and disease. So yes, the answer is that having an infection decreases the likelihood of reinfection, but we did see that a lot of people who were primarily infected, had an infection, ultimately went on to have a reinfection. I think many of us know people, I know many in my own family that were infected once, were infected again. It doesn't prevent you from being reinfected. It does seem in most scenarios to decrease the likelihood of severe illness, but it does not negate the importance of getting vaccinated if you have been infected previously.
Thank you for that. And Mark Zandi, let's bring you back in too. One of the things we're talking about here is this surge, coming through this surge, but also the long-term consequences on careers people choose, on how populations take advice. I'm really curious what you're thinking about in terms of longer-term economic consequences of a generation of people who've lived through this pandemic.
Yeah, that's a great question, Susan. I think there are going to be a number of long-term economic consequences. I think the one I would call out is remote work. I think that's a game changer. I think, you can see it in the data. I mean, just to give you a sense of that, in the last year, about 700,000 more people moved from urban centers of major metropolitan areas to suburbs and exurbs than moved in. And that's more than double what it was in the year leading up to the pandemic. And the big, large cities in the Northeast Corridor, New York, my hometown of Philly, and on the West Coast, Chicago, are losing lots of people. And they're moving to the Southeast, they're moving to the Mountain West, they're moving to Texas. So I think there'll be some coming back of remote work as office towers reopen, as businesses reopen, ask their workers to come back to work in their offices. But there's no going back. And so it has enormous if that's the case, that has enormous implications for regional economies, for real estate markets, the housing market, the commercial real estate market. What about those office towers in New York or in San Francisco? The finances of state and local governments, the labor market, dynamics, productivity growth. I mean, for a macroeconomist, it has enormous. There's enormous fodder here for research and work. So I think there's going to be a number of longer term consequences, but I'd say that's probably the most significant. Remote work is the result of the pandemic, and it's here to stay.
Thank you for that. Dr. Messonnier, let me come back to you with an audience question, which is, what do we know about long COVID?
Yeah, so this is another one of those questions that I think Dr. Spencer is probably better equipped to answer than I do, since he's actually treating patients and I'm not right now.
I'm happy to step in as someone that has some experience with this, not just with seeing and taking care of long COVID patients, but as someone myself who has long-term ramifications of a previous infection. In 2014, I was working in West Africa, providing clinical care during the Ebola epidemic there, and was infected myself. Spent 19 days in a hospital in New York City, and thankfully kind of physically went back to full health within a few months. But even now continue to have some long-term memory impacts and others that are directly related to that infection. I'm very glad to see that there has been a community primarily of patients themselves that have led a lot of this research and advocacy from the ground up, starting in April and May of 2020, have started conversation around this, have got the World Health Organization involved, have gotten funding from the NIH to further study this. What we know is that long COVID is real, that there is a significant proportion of people who get infected, who continue to have symptoms weeks, months, and for some, years later. We don't know exactly why long COVID why COVID can cause these lingering symptoms in some people and not others. There's a lot of research going on in this. We know that vaccination for those that have had COVID seems to decrease their symptoms. We know that there are other kind of physical medicine and rehabilitation things that can be done to address some of those symptoms. And there's a lot of long COVID clinics that have been set up around the country. There's still a lot of questions, but I think the shining light of this has been the recognition that all viral diseases, whether it's Epstein-Barr virus or Ebola or COVID, can cause long-term impacts. And I'm hopeful that that will open up many doors and opportunities to better understand the impact of other viruses on kind of lingering and long-term symptoms, of which there are likely a lot more in our society that have been overlooked for quite some time.
Thank you so much for sharing that. That was a very powerful personal story that I'm sure will be impactful on our audience. Jennifer, as we come to the close of the program, let me ask you the last audience question here, which is, why is it still important to be masking indoors?
So honestly, I think it's because there's a few things. One, just proximity in terms of the spread and transmission. A lot of asymptomatic positive people that don't know they're ill, but also just kind of minimizing that until we know we're beyond this. And we've talked about being vaccinated and having breakthrough cases and then being reinfected again. All of those are possible. And so to minimize it, the masking really is doing a piece of that and trying to reduce the pieces that potentially we could control. And I say control loosely there.
Thank you for that. And Mark, you have a book that we can all see that says the best loved poems of all time. And, if we talk about recharge, which I love as a word that captures a mission for the next year, connecting as whole people and joy as an act of defiance and connecting with our own humanity is so important. And so, which is your best loved poem of all time, Mark?
Well, I have to admit, I'm in my mother-in-law's home, so I am in a venue I'm not very used to. So I'm glad that's what you saw, though. Thank goodness for that. I had no idea what was there. So
Well,
wrong question.
You should change your book because you're going to get the question again. I will send all of you that one of the poems has been giving me a connection to joy and humanity in this time. I'm so grateful to each of you for being with us. I think as we try to get the word out to communities, businesses, and thought leaders across the country, your words will be very important and impactful. So thank you for what you're doing. And thank you for helping our audience understand both the short and long-term consequences. So thank you all. To the audience, thank you so much for joining us. We'll share the details on our next Path Forward very soon. In the meantime, if for no other reason than to help your local healthcare workers and nurses get vaccinated, get your booster shot, wear your mask, and let's get to the other side of this. Look forward to seeing you soon.